Hello, hi everyone, I'm Smita Mehra from the Neem Dental Practice. Today I'm going to talk to you about dental emergencies. Now, since we've been locked down, we're receiving lots of calls from slightly worried patients, anxious patients, new patients who can not get hold of anybody at their own clinics, and wherever possible we're trying to do as much as we can on the phone. I'm trying to do as much as I can with advice on the phone to them during these times where I don't know when. Hopefully soon, but we'll be able to get you back in and get you on the road again with regards to your teeth. So there are a few emergencies that are coming our way. Luckily, nothing majorly serious right now, but a few things that are coming through. For example, I've broken my tooth. I had a filling, it's come out, or there was a crack in my tooth. I was meant to get it sorted, and then all of this happened, and so now it's finally broken. What shall I do? With things like that, obviously, in normal times, we would get you in, we would get you, get a proper filling placed, and we would get you in and out, and that would be the end of it. You'd forget about it. Or at the very least, we would get you in, we would put a temporary dressing in there, and we would send you away for a week or so, and then get you back in and do a permanent filling at a more convenient time. At the moment, unfortunately, we're not able to do any of that. So what we're recommending is that you go to a local chemist and get a sort of self-help kit whereby there are temporary filling materials that you can get in that are either pre-mixed, or you mix two sections together and you make them into a ball and you literally stick it in with your finger. The only thing that you have to watch there is that the tooth is bone dry. So you have to get either a cotton wool roll or pledge it, or a little tissue or gauze, dry the surface entirely, try and make it as bone dry as possible, because that will really determine how long the filling stays in place. And then you pop this filling in, mold it on the tooth. Remember, usually with these things, they set hard. Now, as you probably know, when you come to us at the dental practice, we usually take this little blue piece of what looks like carbon paper, and we pop it in between your teeth when we're checking your bite, and we say to you, bite together, grind your teeth left to right, forwards and backwards, and then open, and then we drill off all the bits where we can see marks. In other words, the high bits. But obviously in this situation, we're not able to do that. So before it goes hard or it hardens, what I would do is mold it to the tooth and then bite on it. Move your teeth about, do all the movements. Make sure that your bite is okay, because we won't be able to drill that bite in later. So, and then take off any excess again with your finger. Try and look in the mirror when you're doing this, and that should be it. You should be fine. The only other issue that has been coming up as a recurring theme with our patients that are calling are things that are abscesses or root-filled teeth, previous root-filled teeth that perhaps are failing, and there is an infection that's rising. Either that there is temperature, they have a temperature, which of course during these times is worrying anyway, or their swelling is getting worse, or their pain is getting worse. Now, again, for anything like this, call us, we will talk you through it. Generally what's happening is an abscess is starting, and we would prescribe some antibiotics to you. We would either send you to the chemist, or at certain times you might be able to come and even pick them up from our clinic, and we would sort that out that way. Other than that, pain problems are coming in with toothache, or things where you've fallen over and chipped your tooth. And again, we would advise you with that, whether to either get self-help, temporary dressings, or we would discuss the individual case. All in all, so far, it's not been anything terrible. We are concerned that going forward, things may worsen or may progress. And for that, we will keep you posted. As and when emergencies come in, we will talk you through them. But give us a call and we will direct you to the right place. In the meantime, stay safe and stay healthy. Thank you.